Push-pull is a technique used for fluid resuscitation in urgent patient situations, such as severe dehydration, sepsis, compensated shock states, as well as uncompensated shock states. In general, the physician will order a fluid bolus of 10 to 20 cc's per kilo of isotonic IV solution, such as normal saline or lactated ringers. So now what we're going to do is set up the push-pull with eyes. So you're going to need a 60 cc syringe, and you'll attach that to a stopcock. And then you're going to need an extension set to go on the other end of the stopcock. And then you're going to grab a secondary set, and make sure you grab the right secondary set, because there is another set that looks similar to it. So this has the shortest amount of tubing, which will get the fluid into the patient that much quicker. And then what we're going to do is spike the isotonic IV fluids. So it can be a liter bag, or it can be a 500 cc bag of sodium chloride or lactated ringers, and you have to do a 2-RN check because that's part of the policy anytime you're giving a fluid bolus to a patient. So yep, that's normal saline, a liter. So we'll spike the bag, and then we have to prime it. And so a lot of times the tubing isn't long enough to reach the patient's IV site, so you may have to brace the IV fluid bag in between your cheek and your shoulder if you don't have an IV pole readily available. So right now we're priming the tubing that's going to attach to the patient. Okay. So we're going to scrub the patient's IV site for 15 seconds. And then attach the push-pull. And then you'll turn the stopcock off to the fluid and open to the patient's IV. So yep, it's open. And so you're just going to push the fluid into the patient's IV. Now you're going to meet resistance depending on the length and the gauge of the patient's IV. And you also want to monitor for signs and symptoms of IV infiltration and extravasation during your push-pull, because you are going to be pushing with force and you might encounter some resistance. So now you'll turn the stopcock off to the patient and open to the normal saline. Off to the bag again, and then flush into the patient's IV. And ideally you can get a 500 cc bag of the isotonic IV fluids in the patient within 5 minutes and a liter of the isotonic IV fluids within 10 minutes, making this the fastest method of fluid resuscitation for patients who are in urgent situations.